Hello, my name's Chris Cantrill, and I'm going to be speaking about benign prostatic hypertrophy, or BPH as most people know it. I'm originally from Dallas. I did all my medical training here in San Antonio at UT San Antonio. Joined Urology San Antonio in 2011 and have been practicing since then. BPH is a very common condition that affects most men. About 50% of men in their 50s begin to have symptoms of BPH, and upwards of 80% of men over 80 begin to have symptoms of BPH. Often, these can be pretty subtle findings, maybe a bit of dribbling at the end of urination, waking up at night to go to the bathroom, or potentially slowing of the urinary stream. BPH can be a very slow and chronic process, so oftentimes men kind of ignore the problem, and it can present pretty suddenly with even the inability to urinate. We see a variety of patients at all stages of disease to be able to help them manage their symptoms and really just improve their overall quality of life. So, like we said before, the common symptoms of BPH would be a slow urinary stream, maybe starting to wake up 2, 3, even 4 times at night, or maybe having trouble just starting the urinary stream. As symptoms progress, you may develop frequent urination, may have overwhelming urges to need to go to the bathroom, or feel like you're just not emptying your bladder. If you're wondering, how do I know if I have BPH? The best way to do that is to see your urologist and allow us to do a history and physical exam to rule out any other conditions that may be causing your urinary symptoms, and to go further into seeing what options do you have. When we talk about options of management, those can be medical management and those can be surgical management. And there's a wide variety of surgical therapies that are available to treat BPH. Some are as easy as coming into the office and undergoing a 3 to 5 minute procedure, or others are done at the hospital. How do we determine that? Is by doing different diagnostic studies to understand the size of your prostate, which is done by an ultrasound, looking at the internal structure of your prostate, which is done with a cystoscopy, which is a camera that goes through the penis to be able to look at the bladder as well as the prostate and understand how severe the disease is. We also have you urinate into a machine so we can measure how fast the urine goes, and that gives us a way to kind of measure your progression over time. And understanding how BPH affects you is, the best analogy I use is the prostate's similar to a donut. The size of your prostate doesn't necessarily determine how severe your disease is, but the donut hole, or the center portion of your prostate, is where symptoms come from. That's why a diagnostic workup is very important, because the size and structure of your prostate help to determine what procedures may work best for you if you're interested in surgical management.